Okay, so right now there is so much of excitement. It was a long wait, but some things are worth waiting for. So the building is completely ready. We are now in what we are calling the testing and commissioning phase, checking the water, the electricity, does everything work, a final coat of paint. The big thing that is left is the ICT, getting the internet and etc. done, and that will be done over Christmas. But other than that, the equipment is being set in, and we've got about 50% of the equipment on site and another 50% in the pipeline. So we're really, ahead in the game. What we've also done is we have set up a team that we call ourselves the operational planning team. We're very lucky to have a group from Intermountain in Utah, who are supporting us technically and virtually to help us with operational planning. And this is a group that has done 26 maternities in the US. And so they have like a checklist of how they go about it. And they're very kindly hand-holding us as we plan our operationalization. Oh, so what I did forget to mention is our opening date. So we're in phase 2 of the operational planning. Phase 4 is actual go live. And we're hoping to have our first delivery on the first week of April. Towards this, we have already, the OBGYNs have already started running clinics, and we recognize that the women who deliver at our facility are pregnant now. So we're beginning our antenatal clinics so that we're cultivating the first clients. So we are really excited about that. What we recognize in this facility is a superior facility. It is really designed and purpose-built to make an impact in Dar es Salaam healthcare, and probably an opportunity to demonstrate the feasibility and sustainability of a new brand of maternal care that is high quality and low cost. High quality is because that's our commitment to the women, and low cost is because that is the environment. So this is really a nice environment. Our vision is that the women who seek care here will have the safety, but we are also looking to safeguard the rights of women, both for a dignified and their rights, the rights for a respectful maternity care. So we're also expanding it to ensure that even the healthcare workers are safe and enabled. So that is a kind of new brand. We see that we have an opportunity to recreate or rebrand maternal health care in low and middle income countries. Some of the unique features that we think that we will add include the fact that we will have a midwife-led model of care. And this has been shown to be both the safest, the least medicalized, the most respectful, and best outcome. So that is the model of care that we will provide at CCBRT. We will also ensure respectful care in terms of the fact that women, even in the public birth, will be done in a self-contained rooms. And this is new for Tanzania. So there will be, we call it, when we were assessed, the assessors who came to see us from the Ministry of the Registrars of NGOs said, after seeing the public, he said, so now could you show me the public infrastructure? And I said, we just passed that. He says, do you mean to say that the public have private facilities? And I thought that was really cool, because I think it's what they deserve, and that's really what we want. And this is enabled because of the superior infrastructure. The other thing is there will be no mom-baby separation, and that is a new thing that we want to add. And birth companions will be routine. Currently, birth companions in Tanzania have only been done in a research setting, but that will be routine for all and available for all women. But my favorite story of all time, and I'm picking this because it shows the impact of one person and small things. So my story is about one of our clinical trainer called Timothy, and he is by far the best clinical trainer I've ever had the pleasure to work with. And so in 2018, 2017, towards this 2017, we had a whole spate of maternal deaths that were coming to one of the facilities we support. Between November and March, they had 3 deaths, and all of them were due to hemorrhage. And the women came in, completely bled out, and there was nothing we could do. We made a decision that I made a decision to send Timothy there and spend 2 weeks to see what he could do. And I remember the first day he went there, he called me and he said, Dr. Brenda, I'm sitting on the outside. This site is beyond hope. They have nothing. It was really in a bad shape. So we kind of rustled up what we could. And then I had to encourage him that this is how we began with all the 22 sites. We just had to do something. So we kind of took our training materials, send them to the sites, and we kind of donated delivery kits, etc., etc. And he spent 2 weeks there teaching them how to manage hemorrhage as well as safe, clean deaths. And it's very, very simple. And I think once they see the possibility, what we need to do is very simple. And what I'm so proud to say is that since then, that's 2018 March, they haven't had a single reported death.
We just really want to say thank you, Dr. Brenda, but also to ask everybody to stay engaged. This is just the start of a conversation around where this is going all the way through to March 31st. And we're talking through sort of thought leadership, collaboration, partnership, all the things that we can do together with you moving forward. But a big, big thank you for making the time today to engage with us.